Periods are a time of bleeding that most girls and women have once a month. It's also known as menstruation, and it's completely normal. Most girls will first experience it around the age of 9 to 14. Let's look inside the body to see what changes cause it to occur. This is the female reproductive system, the parts of the body used to have sex and involved in producing a baby. It is made up of the giant uterus, sometimes called the wound, fallopian tubes, and ovaries. The ovaries hold thousands of tiny eggs, but usually only one egg will be released each month. The egg will travel down one of the two fallopian tubes and into the uterus. The inner side of the uterus will also become thicker around this time. If the woman does not have sex with a man, then the egg is no longer needed and the inner side of the uterus will break down to become thinner. This material will flow out of the vagina as blood. That process is called a period. The bleeding usually lasts for 3 to 7 days. So how should you manage your period? You can use pads or tampons available at your local supermarket or pharmacy to soak up. The bleeding pad can stick to your underwear. These should be changed every 3 or 4 hours to avoid the blood sitting in the pad for too long, which might cause a smell. Tampons are used differently. They are inserted into the vagina and later pulled out using the string. Tampons should be changed every 3 or 4 hours because there is a risk of infection. If you leave it in for too long, both pads and tampons must be thrown into the bin after each use. You should never try to flush them down the toilet. What can you do when you have your period? You can continue with all your daily activities. When you have your period, including work and exercise, it's perfectly fine to wash your body during this time, and there is no need to wash deep inside your vagina. How do you feel when you get your period? Sometimes you may feel sad. This is due to hormonal changes happening in your body. If it becomes a problem, speak to your doctor for advice during your period. You might also feel some tightness below your stomach. This is normal, and it is safe to use some types of medication for light pain relief. If, however, you're feeling a lot of pain, this may not be normal, so you should speak to your doctor. Finally, when will you stop having your period permanently? Women will usually stop having the period between the ages of 45 to 60. This is called menopause, and it means they will soon no longer be able to produce a baby. Remember, having your period is completely normal, and it's not something you should be alarmed about as long as you manage it with good hygiene and notify your doctor. If you're feeling unwell, it won't stop you from living life.